Good. All right, so we're going to do a teaching today on atrial fibrillation and medications. So the purpose of this is to provide the patient with information on how to remember to take all their medications using a pill organizer. So my patient would go to the pharmacy and pick up their bag of supplies and then come to the teaching. Our goal is the patient will be able to create an organizing system to help decrease medication errors, create a medication list to set near the pill organizer, and list of medications taken, and then a piece of paper where they can check off that they really did take their medicine. Nursing diagnosis for my patient. So he was brand new to AFib. So he was knowledge deficit related to lack of information as evidenced by questions and statement of misconception. At one point during the ER visit, he did state, if I don't feel it, I don't have it. So that explains the diagnosis. And then, so with AFib, atrial fibrillation is where the heart's two small upper chambers, which are your atria, don't beat the way they should. The atria beat irregularly and too fast. With this, it fires randomly, which can cause an interruption in the normal conduction of the heart. So in here we have our atria, and that's where the quivering starts, and it just is rapidly firing through the atria and the ventricles. So that is that. And then my patient was brand new to taking warfarin. So he actually went and seen his primary care doctor the next day after we saw him in the emergency room. So my patient went to the pharmacy, he picked up his bag of supplies, so he's here for his education, teaching with me. So he's got a sign here that's gonna say refill your pill container on Saturdays. So some people get in a habit where they fill their pill organizer once and then they never use it again. So he's gonna tape that up right above where his pill organizer is. This will be his chart of the medications. So when he takes them all on that day, he's just gonna put a check mark in that chart that he took them. Here's his medication card of the pills he is picking up from the pharmacy. So he actually went to the Grant County Pharmacy here in Fenimore, as you can see. So we have our aspirin that he's gonna take once a day. We have his levothyroxine he's gonna take Monday, Wednesday, he's gonna take that daily. And then he's gonna take his warfarin. So this is a new one for him. So with that, he's gonna take one tablet by mouth Monday, Wednesday, Friday, and then he's gonna do a half a tablet by mouth Tuesday, Thursday, Saturday, Sundays. The orange ones in here are the half a tablets, and the red ones are his full tablets that he's going to take. And then here's his pill organizer that he picked up. So starting with the cognitive portion of this, so the outcome that I have for him is that he will identify signs and symptoms of atrial fibrillation and discuss side effects of the medication. So our main focus is that warfarin, obviously, because it is new. So some signs and symptoms of atrial fibrillation, we want to tell our patient to kind of watch for any lightheadedness, dizziness, getting tired during exercise, that shortness of breath, and feeling of palpitations where your heart's going to jump out of your chest there. So the content that we're going to outline, we're going to discuss the definition of atrial fibrillation like I already did, signs and symptoms of atrial fibrillation like I talked about already, and then the warfarin side effects. So I gave my patient a handout here. So warfarin side effects, he can experience cramp, nauseous, and fever. And then with that, he can also have easily bruising since he is taking warfarin and aspirin. So bruising is another one. My teaching methods that I selected for this were verbal explanation and then printed materials, which I have here for my patient. And then the supplies here, like I said, he picked up his medications from the pharmacy, the pill container, the reminder, checklist, and the medication list. And then my model chart I used for explaining atrial fibrillation. After we're done today, my patient will take a post-quiz regarding all of the material that we went over. So a psychomotor, for my patient, a goal and an outcome would be demonstrate proper technique when organizing medications using a pill organizer. So my patient brought all of his medications today, and we will place each of those here in the pill organizer, and he will demonstrate that. So content outline, organizing medications in the pill organizer, and then setting an alarm for when to take the medication at proper time. So we want that patient to use his cell phone at this time, and we'll kind of go through, okay, if he takes pills Monday, Wednesday, Friday, like warfarin, you want to take that the same time every day. So we'd want to set that reminder on his phone to buzz him to take your warfarin. If he takes it at 6 o'clock at night, we're going to set the alarm clock for that. So the teaching strategies I'm using is demonstration and then return demonstration from the patient. Obviously with this, I'm just going to be demonstrating how to do it. So again, we have our pill organizer that we're going to be using. We'll set the alarm on the phone, and then I'm going to observe the patient, which again is me during this time. So then another psychomotor is we're going to place each medication properly in the compartment that it is going to be taken at. So we're going to follow the medication instruction of what time of day and which medication we need to be taking. So again, that's by placement here. So practice return demonstration. We're using the pill organizer, home medication list, and observation from demonstration. And then an effective and cognitive outcome, we want to express any concerns about the medication. So this, you would be asking the patient if his wife was present. You want to know who's going to be placing those pills in the container and how they feel about that, and if there's any concerns. Because not only does he have 3, but in 2 months he might have a total of 6 medications he's taking. So does the wife feel comfortable placing them in the pill container, or does the husband who takes these pills feel comfortable putting them in the container? Comment outline, we're going to explore those feelings from the patient and the spouse. We're going to do that through discussion, and then printed off medication list, which we have here, and then the colored reminder sign of when to fill that, and then question and answer through the post quiz and discussion. So now I'm just going to go ahead and demonstrate how to put your pills in the pill organizer, and then we'll go through the post quiz and then go through our pamphlet as well. So I'm just going to read my medications here. We're going to start with his aspirin. So he's going to take that once a day. So we're going to start on Sunday, and I'm just going to pop open the container here. So he's going to take that once a day. So I'm going to put an aspirin in each container because he's going to take it daily. So at this point, his aspirin is done, so we can set that aside. And again, I would want patient to be demonstrating this back to me. And then we're going to go to the next one. So he's going to take levothyroxine 100 micrograms daily. And one thing with levothyroxine, you want to make sure the patient is having labs checked, because if he can get too much of the hormone, it can put him in AFib, and then vice versa with too little of the hormone. So again, he's going to do this once a day. And then his levothyroxine is done. And now with the warfarin. So this is his most important one, and it's kind of tricky because he's actually doing 1 full tablet Monday, Wednesday, Fridays, and then he's doing a half a tablet Tuesday, Thursday, Saturday, Sundays. So the red ones are what he's going to be doing for full tablets. So he's going to need one on Monday, Wednesday, Friday. So we need Monday, he's going to do a full tablet. Wednesday will be a full tablet. And Friday will be a full tablet. So we'll close those. Those are all done. And then he's going to do the half a tablet by mouth Tuesday, Thursday, Saturday, Sunday. So Sunday, half a tablet. Tuesday, Thursday, and Saturday will be the half a tablet. So now his pills are all in his container. And then I would check back to see if he did that completion. And then when he goes home, he's going to set this by his medication container. So when Sunday comes, he's going to take his pills. So he's going to take these out. And he's going to eat them or take them with a glass of water. So took our pills. So Sunday we're just going to check that box off. And he would follow accordingly straight across here for that week. And then following down on the sheet, week number 2, week number 3, week number 4, and so forth. And then on Saturdays, like we discussed, he would refill that container. So then going on with the warfarin, some things we would want to teach about warfarin. Why is taking warfarin so important? Warfarin is an anticoagulant which helps prevent the formation of blood clots and helps reduce the risk of having a stroke, heart attack, or any other serious conditions. We already talked about the side effects of warfarin. What lab tests will be monitored? So he is a new patient to taking warfarin. So he's actually going to have labs frequently until they get the right dose. We'd want to monitor a PT, INR. INR for someone not taking Coumadin is 0.8 to 1.2. Like for our patient, he's taking it, so we want his INR to maintain between 2 and 3. We want to notify patient to monitor stool and urine for occult blood before and during therapy, so blood in the stool. Warfarin dose will be changed accordingly to the lab test. So like I said, he's going to be going to the lab frequently here starting out. Patient teaching. So we want to tell our patient limit intake of foods containing vitamin K, as vitamin K is the antidote for warfarin. So foods to avoid / limit your intake on is kale, broccoli, lettuce, spinach, pickles, pumpkin, soybeans. Avoid the use of cranberry juice during therapy. Use of a soft toothbrush. Do not floss, and use an electrical shaver while on therapy, as you're at risk for bleeding if you choose to shave your face. Reporting any symptoms of unusual bleeding or bruising. Pain, color, temperature change of body to your healthcare provider immediately. Also, if you are sick, you need to contact your physician, as that could affect your blood test and how much warfarin you need to take. Limit your intake of alcohol. And when should you take your warfarin? So you should take your warfarin at the same time every day. Usually it's in the evening. Again, we'd want to set that reminder on the phone, which we did with our patient. And we set that for 7 o'clock, and he's going to do that every day. When to seek immediate medical attention. If you have severe headaches, head injury, bleeding that won't stop after pressure has been applied for no longer than 10 minutes, and any chest pain or difficulty breathing. What other medications can alter the INR results or risk for bleeding? So if you have any antibiotics, aspirin, naproxen, ibuprofen, any herbal supplements, or any over-the-counter drugs. Supplements with vitamin K, as vitamin K is the antidote for warfarin, and anti-seizure medications. So we'd send this pamphlet home with our patient. And then just touching on the post-quiz, we'll just go through that. So a normal heart rate we like to see in patients is 60 to 100. The rest of those do not describe a normal heart rate. AFib raises your chances of a stroke, as that clot can head to the brain. The best test to see if you have AFib would be an EKG. That's our first line testing. And then a jolt of electricity to the heart can help with AFib. That is true. So that's kind of what we did that day with our patient. We did that cardioversion to get that heartbeat back into normal sinus rhythm. And then what medication class does warfarin belong to? That is C, anticoagulant. So our patient did really well with his teaching. He verbalized understanding. So my patient was sent home with his pills already in his organizer. So he is set for 1 week of his pills. And if he has any questions, he can contact the clinic. Thank you.
13 minutes.